One county in Indiana is coping with an extreme outbreak of chickenpox.
Doctors seeing more than 80 cases in recent weeks, making it the largest known current outbreak in the U.S. So why is this happening when there is a chickenpox vaccine? Dr. Ernest Patti is a senior attending physician of emergency medicine at St. Barnabas Hospital in the Bronx. So what causes chickenpox and why is this happening?
Well, the chickenpox is caused by the varicella zoster virus. And, you know, in the old days, when Greg and I were little, we used to go to chickenpox parties, and we would get immunity from someone at the party who actually had the disease. They would pass that disease on to us, we'd develop it, and develop our own antibodies. But since '95, they started with a vaccine that's been very effective in preventing chickenpox.
Now, why all the fuss over this?
Well, part of the problem is that the chickenpox disease can be very bad for certain populations. Newborns, pregnant women who haven't had exposure to chickenpox, people with immunocompromised states such as HIV, or cancer patients who are undergoing chemotherapy, patients of transplanted organs. All those people are at high risk to developing serious complications of chickenpox, which the normal healthy population may not experience.
And you mentioned there's been a vaccine available since 1995.
In '95, yes.
Are less people being vaccinated?
Well, that's an interesting question. Vaccination in some populations is considered controversial. Plus, people who emigrate here from other countries may not have had a full series or may not have even been vaccinated at all. So in answer to your question, it's possible that there are new groups of people that are coming here that aren't vaccinated and exposing the rest of us.
So what's going on in this one county in Indiana?
Well, what they found was 84 confirmed cases of chickenpox, which is a large number in a small population like that. Now, it could also be because we're better adept at doing surveillance for this and figuring it out. You know, sometimes children will get a mild form of chickenpox with a mild rash, even those who've been vaccinated, and they may not even realize that they've had chickenpox.
And were they able to trace where this latest outbreak originated?
They said that they found it started with one unvaccinated person who attended the school. Okay. They're the source patient.
So what can be done about this?
Well, the most important thing is you have to make sure that your children are vaccinated, and that's very important. You need to speak with your doctor and make sure the child is vaccinated for chickenpox. But also, you need to make sure that you keep a healthy immune system. You need to make sure you have a good diet and exercise, and the common sense things that we talk about every time we discuss a health-related topic.
Well,
here.
It seems simple. It seems it's a given. But what are the risks associated with being vaccinated for the chickenpox?
There's always risks that people get. Some people develop viral syndromes. They also develop a mild form of chickenpox from the vaccine. But the important thing is to remember that it develops immunity in your body that's going to be lifelong. And that's important for you because the same virus that causes chickenpox also causes shingles later on in life.
Yeah, I was going to say, and that can be, because if you have chickenpox or you're exposed to chickenpox later in life, it's latent in your body for years, for decades sometimes. And then it hits you later in life, and shingles can be really painful.
Oh, it's extremely painful, and it's debilitating in a large number of patients. And it could be very complicating in people who are immune compromised.
But this vaccination doesn't guarantee that you won't get that.
It doesn't guarantee it, no. No, you have to remember, in every individual person, the immune response is different. And there are some people that develop viral illnesses after vaccinations, and it's a controversial subject that we can speak about for hours. But in the experience that I've had, and most doctors would agree, it's better to be vaccinated for childhood diseases like this because the complications that can occur, especially in healthy children who get chickenpox, can be very serious. Pneumonia, encephalitis, cellulitis, and the rash that kids get. These things can be very debilitating.
Yeah. So, all of these vaccines are out there, and it's wonderful. Measles, mumps, now chickenpox, what else?
Well, we vaccinate children for rubella. We also vaccinate them for hepatitis, for the flu. Everybody needs their flu shot. Did you guys get your flu shot this year?
Yes.
I have not done that yet.
Oh, Heather.
Yes, I just jinxed myself, and you jinxed me by asking me, so
Sorry,
now I'm going to have to do it,
that.
for sure.
Yeah, I already got mine.
Thanks for having me so much. Appreciate
Dr.
it.
Ernest Patti, as always, St. Barnabas Hospital in the Bronx. Thanks for being with us.
Thank you.
Let's go back to the urgent bulletin we were just telling you about.